Hi guys, I was asked, does going to nursing school help you in medical school? And I'm just going to talk about the nursing school portion, not the actual working as a nurse, because I feel like working as a nurse helps a medical school way more than the actual going to nursing school part. So I'm going to break it down to two things because I did my nursing training in two different segments. The first one being my associate's degree, which was at a community college when I was very young. I was a teenager when I started that. And then the second part of that was doing my bachelor's degree at a university. So the associate's degree part was I went to lecture and I had clinical parts where I was in the nursing home or the hospital, and that has helped me form a backbone in medical school, being able to be familiar with different words like hypoxia and congestive heart failure. So when I see those words in medical school or I hear them, I don't need to relearn them, I already know them. And then from being a nurse and working, I have seen thousands of patients with those things. So that further cements my knowledge of different things when I hear them again in medical school. Moving on, and then with my associate's degree, we had to do a lot of skills check-offs, like we learned how to insert a Foley, which is a tube that goes into the urinary tract of a male or a female, and the urine goes out the tube. And we would be assessed doing that skill. So we would have to do it correctly in front of a person with a checklist of whether we did certain parts of it right or wrong, and graded accordingly. And I think that really helped me in medical school because we had the same types of, maybe not Foleys, but different skills that we have to know, like how to do physical assessments correctly, that are also important for our boards. And then moving on to the bachelor's degree portion, which some people do it all together at a university. It was basically paper writing. I didn't learn about any other diseases or anything like that. I didn't learn anything more that helped me as a nurse. It did help me obtain a different job, but I only made like $1 or $2 more an hour as opposed to just having an associate's degree. So it didn't improve me as an actual nurse, but my paper writing skills greatly increased, which doesn't really help you in medical school unless you do research and you're writing a lot of papers. But it did help me perhaps to get into medical school because I had some publications that came as a result of my paper writing skills that I got most likely as a bachelor's degree student in nursing. And then it helped me as well during my master's degree, which was mostly writing papers, which maybe my master's degree helped me get into medical school. So my bachelor's degree in nursing didn't help me yet actually in medical school, but it may have helped me get into medical school. So to recap, so far, since I have not done the clinical parts or the clerkship parts in medical school, I can't really comment on how that has helped me being a nursing student in nursing school and then going to medical school and doing that in the hospital training. But I'm thinking that it'll help me a lot because I can walk into any hospital and know who is dating who, which nurses to stay away from, which doctors I can ask questions from, which ones I should stay away from, all those types of things, the climate, within minutes, because I've been in different hospitals working and doing clinicals, and it's pretty easy to figure out when you have decades of experience doing different things. So in summary, having a nursing or going to nursing school does help, but it'll only give you the backbone information. There's a lot more to learn because medical school will actually go down into the biochemical processes of different disorders, while nursing school doesn't. And nursing school focuses more on, I feel like they want to trick you almost with their questions. Like they'll give you a question, or in lecture they'll tell you water is wet, And then during their nursing exam, they will give you answer choices like A, water is moist, B, water is slippery, C, water is not dry. And then you have to figure out which one is the best choice of those. And that's probably that was the hardest part for me, was being able to figure out exactly what they wanted and choosing the best answer out of multiple answers that could be correct. And medical school is not like that to that extent. It's more like here's a fire hose amount of water thrown at you and you're trying to drink it. It's just too much information, and some of the information is rough to learn in a short amount of time, but most of it's easy, but you don't have enough time to go through all of it. So you have to figure out how to, or learn what is important to learn, or what you need to know for exams, and what you can just kind of put off for a little while. So if you're a nursing student and you really want to go to medical school, please do it. You're going to be wonderful. Whatever you learn in life, it's going to help you later on. Don't not go to medical school because you're a nurse and you don't think your nursing school had prepared you well enough. So that is all. If you have any questions or comments, please put them down below, and thank you very much.